Kevin, let's talk about chronologically. You come from this homeless background. You're uprooted from this ideal life that where you're living there with your brothers to all of a sudden become an orphan. All of a sudden you got to find yourself. Now, education, especially in the medical profession, I've had instances where I had a friend of mine whose son went to Carson Newman University on a full ride football scholarship. And that was a little tough because he had to sit there and work. So he finally talked his parents into letting him go, say, I need to transfer to University of North Carolina because then I can go to medical school. And then he ran into organic chemistry. And he's now, instead of Dr. Charlie, he's selling insurance. Now, tell me about the education to get to where, did you have any trouble with organic chemistry?
I did not. Actually, it was quite easy for me. Organic and, you have two. You have organic and non-organic chemistry. And I found it relatively easy. It just glided through. So for me, I found it inviting. And then obviously that opened the dialogue and the door for understanding and becoming more interested in life in itself.
But is that the reason why you chose not to be a medical doctor?
Correct. It is. So I went to junior college at Shasta College for 3 years. And then undergrad in Oregon, I enrolled at OCOM, Oregon College of Oriental Medicine, and they had joint programs with OHSU, Oregon Health Sciences University. And to answer your question, my interest in science was so much that I realized this has to be the platform or the stage on what we recognize as I mentioned before, the three simple particles making up life and consequently what happens in pathologies. My interest became, why does diabetes occur? If we look at atomic structure or substance structure, composition structure, compounds and things like that, there has to be an answer if we get down to the basement. So I actually found organic chemistry fascinating because organic chemistry represents life. That's what we represent. It has to do with carbon base. And that to me is what really became fundamentally appealing to me.
But does the fact that you were able to overcome the disease which you had with being a diabetic, is that something that fueled?
Exactly. By me taking care of my diabetes in the best way I could, that showed me an emphasis of life that, listen, we don't have to be held captive to a condition that we're going to be told we're held captive to. The doctor, I remember him telling me, and he was a GP, he said, you're going to be on insulin. At the time, that's what it was, is insulin. There wasn't metformin or anything like that.
And that's the shots.
Exactly.
Where you prick yourself and then
Exactly. Right in. You can do urinalysis and you can do strips and things like that. And at that point, it opened up for me. I realized, listen, if I was able to take care of this for myself, and I'm still good. I mean, I'm no symptoms of diabetes at all. And, I'm 64 years old now. And it's like, this to me is the answer. If we can understand the premise on why pathologies start, causative factors, we now can address medicine as causative, not symptoms. If I ask you a question, Benny, how many drugs are designed to treat symptoms? And how many drugs are designed to treat causes? What would you tell me?
More on symptoms
Exactly.
than causes.
It's all symptoms. We can take that pain away. We're going to put you on this. We can get you to sleep better.
But at an expense.
Exactly.
At an expense.
Exactly. Side effects. And then what happens is we have stacking. It's called stacking. So let's take care of the pain that the statin is creating for you by giving you a pain medication. Now you're beginning to stack. Now the pain medication is creating a condition where you might be suffering from edema, as an example, or high blood pressure medication like an ACE inhibitor or something like that. And then you start stacking. Oh, you have PAC, premature atrial contraction. Guess what? We're going to put you on a calcium channel blocker. We're going to do this. And that calcium channel blocker is going to create this problem. We're going to put you on another medication. All we're doing is stacking.
Is that why
drugs.
whenever there's an advertising for a drug, the first part is very joyous because they overcome it. But as they overcome it, then all of a sudden you got a guy whispering over there, you may not ever be able to do this again. You may not be able to go, wait, why is he saying that so slowly?
And to your point, notice how much time is given for the negative. It's actually more time than giving the positives. And if you're in the car industry, if you were to market a car like that and give the negatives to the car, do you think people would buy it? If you spent half your commercial saying this is what could happen, the brakes could lock up, but for some reason, humans seem to erase the negative contraindications with a drug that could actually create death in conditions in some situations, and they're willing to take the dive.
Well, it's interesting you bring the car industry into this because, again, whatever the car industry advertises, that's what they're making the most money on. And that's why they're advertising that. Mm-hmm. So, when you talk about, how easy it is, for lease, now those are all the things that would entrap you. Mm-hmm. But again, in your particular case, you had this thirst for knowledge. You had this thirst for education. So it went beyond just the education in the United States. You also learned about Eastern medicine.
Mm-hmm. Correct. And that brought another interesting aspect. The idea of yin and yang, which is very popular in Asian philosophy and acupuncture as an example. And that indicates the parameters of extremes. Yin represents the female as an example. Yang represents the male, or one can be considered the positive, one can be considered the negative. And it aligns with physics to some degree. And the idea in Eastern medicine is to treat based on these excesses, these deficiencies. It doesn't look specifically in a sense of a noun. It looks at more, you have an excess of heat, you have a deficiency of qi as an example, and it's meant to bring equilibrium in medicine, a balance, something that is often overlooked in Western medicine. And that's the beauty of Asian medicine. I don't practice it that much, and I have a degree in it, but it's the emphasis that I really admire. To give you an idea, in traditional Chinese medicine in Asia, a practitioner was paid when his clinic was empty, not when it was full, because it showed that he or she was doing their job.
And you could go play golf on a Wednesday.
Exactly. Where here, the opposite in allopathic medicine, if your clinic is full, you're bringing more money in regardless if you're taking care of the person or not. Now, that's not to emphasize that doctors don't have the patient's best interest at heart. I'm not suggesting that at all. It's just an interest. It's an interesting comparison that we see.
Before I met you, I did have some issues with my left knee. And as a kicker, I kick with my right foot. So they always say, well, how come you didn't have more problems with your right? Well, the right leg is not really doing the job. Because, the left leg is that's my plant foot. So that's what's taken my whole weight, and it's centrifugal force. The faster I can stop, the more force behind that to go ahead and kick the ball. And so I went to an acupuncturist, and I did a little research before that. Guy's a 72-year-old Korean guy. And I went in there, and I said, okay. So I looked at him, and I said, okay, I've done a little research on acupuncture. Look in my eye and tell me what's wrong. And Kevin, I'll be darned if he didn't pinpoint it. How does that happen? As an acupuncturist.
I think it's part of being sensitive, and it's part
of.
But
is the eye a map of the body?
Well, it can be in Chinese medicine. The face can be a map. As an example, the nose represents the heart, the cheeks represent the lungs, the ears, the kidneys in general. So if a finely tuned practitioner of Chinese medicine is allowed to look at you, and pulse diagnosis is very common, they're able, even the scent, the odor, even the sound of your voice. I taught martial arts for I think it was 30 years or something like that. And I would teach that you could actually diagnose by the voice, the sound, if it's loud, if it's soft, if it's crying in nature. And it was about 80% accurate. You could actually listen to the voice and get a general idea of what was going on. If they shouted, if it sounded singy, you know, people have a lofty sounding voice. You could almost get a diagnosis just from listening to them.
So if Mike Tyson came up and says, "Hi, my name is Mike Tyson,"
Yeah.
what would you think?
Yeah, basically what that is, that high-pitched voice has to do with spleen and pancreas. Yeah, that's how, so you, and that's a singy high voice. A groaning voice is kidney. Basically a voice that's angry is liver. It doesn't have to be, it's like a shouty voice. Just a abrupt, that's generally liver. And then we look at coloration, green, red, yellow, white. That all gives us an idea, even looking at the body. We can.
What about yellow?
Yellow is generally has to do with the spleen in Chinese medicine. Even though
Is that a preface for death?
well, no, not necessarily. It means that it's out of balance. In Chinese medicine, in Western medicine, we look at yellow as jaundice, like, hey, we have bile. And that's not the case in Chinese medicine. In Chinese medicine, death would be gray, or this lack of vibrancy. And that's where the kidney function is losing complete. And in Chinese medicine philosophy, the kidney is the essence. It's the jing.
Now, without knowing any of that, I've had 2 instances in my life where that coloring showed me something.
Exactly. Not just that, and if we become finely tuned, we can hear the voice. We can smell the person. You know, if they have a pungent smell, a salty smell. If we become finely tuned to this, we become more aware of even our own health, about what's happening. And then that can even translate into our tastes and what we're desiring, what we are craving, as an example. So there's various ways of looking at this. You can even look at the face. So I do artwork as a hobby. And lines between the eyebrow, liver. Bags under the eye, kidney. Lines, the nasolabial fold, lungs. The prostate, the jowl. The temple, the spleen. The intestinal tract is located in the forehead. You can actually begin to see similarities as it reflects itself in the face.
When I read that in your book, because you were given descriptions of people, and they were graphic descriptions of the face, the appearance, and all those kind of things. And that to me, it seemed like, you were writing about being a 17-year-old, but it seems like there was another application that was being used to that.
Exactly. It's the awareness. And it gets back to the point that you brought up, Benny, about life and being aware of what we're dealing with our surroundings, and what we've been taught and what we don't experience. And let me put it this way, in very simplistic terms. When I talk about physics, and I'm going to make this real quick, if we extract a drop of water from a lake, and we take that drop of water with us for a week, you have it, you recognize it, and for the sake of the conversation, evaporation doesn't occur. It's held by surface tension. We take that drop, we identify it, we name it, put it on the windowsill, we talk to it. What happens when we take that drop back to the lake and we drop it? What happens as soon as it hits the surface of the water?
It evaporates.
Or it becomes one with the whole lake. It touches the shores immediately. And to me, that's the summary of understanding health, mental aspects. People that meditate, I believe, I might be incorrect, try to obtain that. And we realize that in science, surface tension, that water, that's expending a lot of energy to remain as a single drop. We as individuals expend a lot of energy trying to be singular. We expend a lot of energy, recognize our identity, our behavior, our moods. That's a lot of energy, and that energy translates into aging. So when we think about it, imagine letting that go, that surface tension go. And that gets back to health, taking care of something like diabetes or rheumatoid arthritis or cancer. Letting that tension go and the parameters go gives us the opportunity, in my opinion, to explore processes that create equilibrium. When you brought up Asian philosophy or medicine, and that's the goal. And
do you apply that to your treatment?
I did, actually. I did.
And still do it now?
I still do. I do an eye treatment for macular degeneration, both wet and dry, and stigmatism, cataracts. I can't explain how it works, but it works. I've had people get their driver's license back, and all it is are just basically pins that are put in the feet and the hands, and it works. It's basically easier than we think. It's taking that drop, letting it hit the surface of the water, and becoming one. And that's the idea of quantum biology. And that's what I integrate as well in healthcare. It's quantum biology. The probability that in the rods and cones of the eye, that particular keratin, a derivative of carotenoid, ends up from one point to another point without a time elapse. It's all connected.
But Kevin, in summarizing your education, I mean, you talk about quantum biology, okay? That comes out of a textbook. You learn from that. Mm-hmm. But it seems to me that you got so many instinctive qualities that take you beyond that textbook, because you apply, the psychological part of it. Mm-hmm. You apply the Eastern medicine. You apply. It's sometimes you extrapolate from each different subject, and then bring it all together, and that's kind of what Meehan Formulations is all about.
Exactly, Benny, and that's what I love doing, because it's inviting all aspects and not becoming subjective rather than objective. And I think many times we have a tendency to fall into a subjectivity of saying this is bad, this is right, this is wrong. And that's where, getting to your point about your trainer at Detroit, without even looking at a supplement and saying, no, you're not going to do that, there's almost this sense of fear. Like, I don't know enough about it, and therefore I'm going to dismiss it completely without saying, hey, this is a possibility of taking care of your condition. And I invite practitioners, me being a practitioner, to listen. Let's listen more. Let's listen to the patient. They're the ones that are teaching us. It's not in what we do many times is we don't want to listen to the patient. We want to say, okay, we have this cookbook medical procedure, and we're going to do this, 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 and you fall into this, without really listening. And that's where I bring up the Asian philosophy about listening also means to look, to smell, to listen, and to invite all of these other different potentialities that can help the individual. There's not just one way of getting to Oz. There's multiple pathways of getting to Oz, and that's what I invite people to do, is to look at all these different pathways that can get us to the point of where we want to be.
Kevin, I think of you, and I'm going to use a baseball term, although I don't think baseball players are the smartest people in the world, because it's the only sport I know where you have to draw a diagram to show these guys where to go. And even then, they don't totally trust them, so they put a coach on first and third to remind them, left shoulder turn. Otherwise, they'd follow that warning track all the way to the fence or end up in the third base dugout. Mm-hmm. You're a utility. You can do so many things. And I remember when I first met you, I thought, okay, acupuncturist, Eastern medicine, the guy's, has got an education, quantum physics, organic chemistry, but yet so many parts of the body. Because then all of a sudden I find out you make this collagen product for the skin. Mm-hmm. And I thought, wait a minute, where does acupuncture, biochemists, all these things come into it? But yet, here you come up with this thing and it works. Mm-hmm. I mean, I'm an example, and I think, one of the things that happens in television, every time I hear about another K in television, I'm going, oh my God, that's just what we need. You go to 4K, with 4K television, it's when you look at some anchor's face, it looks like you're looking at the crater on Jupiter. It just, why do they want to make us look that bad? And they want to get closer and closer and closer
Sure.
and closer.
Sure.
Thank God for your collagen.
Well, thank you. And the premise about that is, once again, it's, Benny, to that point, it's more educating what not to use. And the simplest thing, like the collagen factor, the collagen boost that we have, ingredients you read and you recognize. You don't have to look at a dictionary. You understand each one. And when I say it's what not to use, the products out there, most all products are basically, they're lipid induced. They have lipid products in it. And I try to educate people, listen, anytime you put a lipid on your skin, it undergoes something called lipid peroxidation. I don't care what any company says our product doesn't do that or whatever. It does. That's science. That's what happens when you put a fat or a lipid on your skin and it combines. Remember, we talked about the formulation. That lipid you put on your skin is no longer just the lipid. It combines with urea, it combines with sebum, it combines with all these things. Now the lipid is no longer a lipid. It changes. And then you have oxidation. You have you have exposure to light. You have exposure to heat. And that's what creates the lipid to begin to change and break down. And that's what peroxidation is. Go scientific on this. I encourage people to be skeptical of what I'm saying, and therefore you look scientific, not at people that are going to tell you that statistics show this or that. I want you to get to the science, and you'll see sites that are done by professors and things like that of notable institutions that address what I'm talking about. And all I'm doing is basically amplifying what they're suggesting and what they're saying. And that's what we're based on, is science. And that's what we want to make sure that is understood, is that this is not something like hearsay or something that we just feel because it's something that sounds fluffy and nice. We want to make sure that we give you the best potential information from a scientific background. That science changes as well. It's an ever-correcting aperture, but we're doing the best we can to give you the latest science.